Hello, thanks for stopping by for this 2021 Medicare Advantage Clarity presentation, where I hope to provide you some clear answers to Medicare questions. This is me. My name is Tom Basie. I provided my phone number and my email address. If after this presentation you have thorough additional questions, please consider reaching out to me and I'll get back to you. Aparte, me gustaría mencionar que yo hablo español, so I'm going to jump into this discussion, but please feel free afterwards to reach out and let's chat further. This is the agenda of what I'm going to cover today. Understanding Medicare choices, eligibility and enrollment, the advantages of Medicare Advantage. That's really kind of some compelling statistics about Medicare Advantage. Prescription drug coverage. I will spend a little bit of time talking about that because it is a point of confusion for people. I think I have some good clarity on that. Then I'm going to compare four Medicare Advantage plans side by side and show you kind of the differences between plans. Talk about how an agent like myself can be of assistance to you. I do have a list of additional resources that can be made available to you that might be of interest to you. And then I am going to remark briefly about what you might consider United Healthcare as a partner on your Medicare journey. So here we go. This is Medicare at the highest level, a red, white, and blue card with someone's name, a number, a unique ID associated with each person has letters and numbers in it, and then the effectivity dates of Part A and Part B. Part A is associated with hospital stays and inpatient care. Part A is. Part B pays for doctor's visit and outpatient. Part A is typically already paid for out of your FICA tax and your paycheck annually, so typically it's already paid for. However, typically you haven't paid for Part B. So when you sign up for Medicare, you've already paid for Part A, you're probably going to pay for Part B. Part A in 2020, the deductible is a little over $1,400 for that hospitalization set component, and there was almost a $200 deductible for Part B in 2020. The cost of the premium for Part B for most people was around $145. So that's at a high level. That's what Medicare is for somebody turning 65 in 2021. Now, having said that, you have two options. You can do option one or option two to cover that which Medicare doesn't cover, for example. So you can get a Medicare supplement, and you get that from private insurance companies, and you need a drug plan as well because Medicare supplement doesn't have drug coverage in it. So option one is to get those two plans. You can get them from the same private company or different companies. I'm a proponent of getting it because there is a penalty for not having drug coverage once you start Medicare. So I think you should either consider option one or option two. Option two is a Medicare Advantage plan. It has the Part A and Part B combination included in it, if you will. It has drug coverage included, and it actually has some additional benefits, maybe some dental, maybe some vision care. So these are two different options. These cost significantly more per month, but have very thorough coverage, very little out-of-pocket costs. These are actually low cost per month, frequently a $0 premium per month, but then you will pay for care. There'll be co-pays, if you will, and co-insurance as you seek care throughout the year. We're going to talk predominantly about option two today. Eligibility for Medicare, 65 years old. You can get it under 65. You can qualify on the basis of a disability or other special situations. It's for U.S. citizens or legal residents who've lived for at least 5 consecutive years. But most of the folks are over 65 and mostly U.S. citizens. Now, there's an eligibility window of 7 months around the month of your birthday. So if you were born in October, the 10th month, 987, in July, as early as July, you can enroll if your birthday's in October because there's 3 months on it, and you can wait if you wanted to. I'm a proponent of go ahead and getting this done, but you can sign up for Medicare and an Advantage plan as well. Mention this once, I'll say it again. You're not required to enroll in Part D. Think of D as in drug coverage. But if you don't, there's a penalty of 1% of the average monthly premium of a drug plan, for example, for each month you delay enrollment. So even if you don't have medications, I'm a proponent of doing option one or option two simply to avoid that penalty for Part D. Okay, now besides that, let's say you've been already enrolled in an Advantage plan. If you're already 65 enrolled, actually every October 15th to December 7th is called AEP, Annual Enrollment Period, and you can add, drop, or change an Advantage plan or Medicare coverage during that window. And then right after that, the first whole quarter of the following year, Jan 1 to March 31, that's Medicare Advantage open enrollment period. You can make a one-time change there. Here, you could do it potentially multiple times. This is a one-time change, only kind of like a mulligan, if you will, is to fix any, somehow your doctor no longer takes a plan. You've got 1 month to do a one-time change, add, drop, or change Medicare Advantage plans that first quarter of the year. Besides that, special enrollment periods, if any of these events occur anytime during the year, then there'll be a special enrollment period that is a window of time when you can also make change. So if you retire anytime during the year and lose a coverage from the employer, well, that's a special enrollment period. You can get an Advantage plan then. If you move out of a plan service area, if you already got an Advantage plan and you move, well, particularly if it's network based, if it's an HMO, you're going to need a different plan. There's a special enrollment period of when you move there as well. If you hit financial hard times and you qualify for extra help, which is financial assistance from the federal government, then that is also a special enrollment period. And then one more is diagnosed with certain chronic health conditions, maybe diabetes, maybe chronic heart disease. Those can potentially be a special enrollment period. So in addition to the other windows we talked about, anytime that occurs, potentially there's a time that you can add or change a Medicare Advantage, for example. Now, this is the advantages of Medicare Advantage. Well, to me, there's just some compelling numbers. Over 24 million people had an Advantage plan in the U.S. as of 2020. Of those, 93% of them are over 90% are satisfied. There's a lot of people have them, and a lot of people really like them. And the third reason is probably why 25% less on healthcare compared to original Medicare. So there's savings. So that's why a lot of people have them, and a lot of people like them, because you can save a lot of money. Okay, this is a nice side-by-side comparing original Medicare with a Medicare Advantage plan. The little asterisk says benefits vary by plan. That's because some of these do. Actually, the first three, coverage for stays, that's Part A. Both of them have that. Coverage for some medical, like doctor's visit, that's Part B, and preventive services like flu. So original Medicare has that. What an Advantage plan has that Medicare doesn't, prescription drug coverage. There is none in Medicare. An Advantage plan has that included. Routine vision, routine hearing. I would actually put even routine dental. Varies by plan, but plans can have potentially all that included as well as your drug coverage. And then here's an important one, limits your annual out-of-pocket costs. There's no limit on the out-of-pocket max of original Medicare. And so potentially you're going to continue to get care during the year, and the price are going to add up. On an Advantage plan, whatever that number is, it varies plan to plan. If it's $3,000, $4,000, $5,000, but at least once you've spent that out of pocket, you're not going to spend anymore. The plan will cover everything else. So that's a nice limit to have in place. Having said that, I'm going to run through this top 10. They're not necessarily in order of importance, but I want to mention all these because they are important. You must continue to pay your Part B premium. As I mentioned, that was around $145 in 2020. Even if you sign up for an Advantage plan and it's a $0 premium plan, and there are plenty that way, and that's great pricing on that, you do have to continue to pay Part B premium. And that's true, actually, even if you're doing option 1, the Med Sup. So you got to keep paying Part B premium to do either option 1 or option 2 to have Medicare Part B. Medicare Advantage has you covered. It's got the Part A and Part B included in it. Joining a Medicare plan may affect your current coverage, both in the instance of employer, if you're switching from employee to Medicare Advantage, or in the case of veterans. There are actually some special plans for veterans. Either one that can affect your coverage, so it's important to be aware of that. Work with an agent can help you navigate that process. It's best to use network providers. We almost never use the word best in the Medicare world, but we can in that one because that's simply the case. It costs less to do so. When you go out of network, it's simply going to cost you more, so it's an easy one to say. It's best to use network providers. That is, it's going to cost less all the time. You may qualify for financial assistance. Kind of talked about extra help from the federal government. Actually, there's a state program. It's maybe funded partially by federal, but state administered, and that's Medicaid. You may qualify for that, and there's specific plans for people who have Medicaid and Medicare. There's some feature-rich Advantage plans for people in that situation. If you enroll in Part D late, you may pay a penalty. I remarked that previously, but that's so important. It merits say it again. So I want to do option 1 or option 2 to avoid that penalty. A Medicare supplement insurance plan, also called a Medigap policy, is not a Medicare Advantage plan. That's the difference between option 1 and option 2. I showed those two there. Medicare supplement doesn't have drug coverage. You need to add one on there. It doesn't have some other bells and whistles like dental and vision. It costs significantly more per month, but it does have very little out of pocket once you pay for that, typically. Keep your member ID card handy. That is, once you get an Advantage plan, you don't have to carry around your Medicare card anymore. You can leave that at home in a safe place. You can carry that Medicare Advantage plan to the doctor, to the dentist if it's got dental coverage, to the vision care provider if it's got vision coverage, to the hearing exam if you got that, to the pharmacy. You just carry that Advantage card everywhere you go. Medicare Advantage offers the same protection as original Medicare, and then some. It really does that. And then you have a built-in financial safety net. That's that out-of-pocket max. I like that. Each plan is different, but it's good to have that there so you know your care for the year will not exceed that number no matter what happens to you. The plan will pay for the rest beyond that number. Okay, I'm going to talk about drug coverage now. This single slide does a great job of explaining a fundamental challenge some people have. If you have a real low-cost medication, onesie, twosie, you may pay even nothing potentially. There's a $0 copay during the year. But the more expensive your drug or drug list is, your pricing can vary over time. So this explains how and why. There are 4 stages: the deductible stage, initial coverage, coverage gap, and catastrophic coverage. So deductible, not unlike any other policy in insurance, that's you got to pay all that until the deductible's been met. So if you have a $300 deductible on a drug plan, and your retail pricing on your medications is $100, Well, then January, February, and March, you're going to pay the full amount because you haven't met the deductible. Once you make that, then you'll jump into the initial coverage phase. That's how that one works. It's pretty straightforward. These next three, what happens is you pay a copay for a while, then you pay a percentage, and then you pay another. It kind of varies depending on what the total cost of the drugs is. So I'm going to make up a new scenario. Let's say you've got some expensive drugs. They're $1,000 retail price. And let's say that the copays turn out on your list to be $100. So in that scenario that I made up, you pay $100 each month, and the plan would pay $900 each month. And so months 1, 2, 3, and 4, and then maybe even into 5, until you exceed that amount, you pay only the copay. So now in my scenario, those first few months, you're only paying $100 on that $900. Once you're in the month 5 and 6, you're in the coverage gap then, because the total cost of your drugs, even though you've only been paying $100, the total cost, remember, is $1,000. Now you're in the coverage gap, also known as the donut hole. You're going to pay 25% of the cost. So it's going to jump from $100 copay to $250, 25% of your bill. You'll pay that for a few months until the cost of your medication exceeds that. And so in month 7, you will exceeded that. Then you're into catastrophic phase. Once you're in the catastrophic phase, you're either going to pay these low copays again, or 5%, whichever is greater. I'm going to conjecture in this instance, well, it's $50. So in that scenario that I made up of a $1,000 bill, you paid a made-up amount of $100 copay, and then a $25 calculated on that made-up amount of $250, and then down to $50. So it varied. So even though it was the same list of medications at the same pharmacy, it will vary depending on which stage you're in. I think that slide does a nice job explaining how that happens. Besides that, I want to talk a little bit more. I want to reiterate, total drug cost is what your copay is and what the plan costs. That doesn't include a premium for if your plan has a premium, but it does count what the drug cost, and that's what's used to determine what the gap is. Out-of-pocket costs does include your deductible, any of the copays you make. Doesn't include, so in either instance the premium is considered, but total drug cost is what it costs somebody, you and the plan. Out-of-pocket is what it costs you. And remember that total drug cost, those two numbers that determine whether you're in initial coverage, the coverage gap, or in catastrophic. Having said that, a couple more remarks. Pharmacy network. United Healthcare has over 65,000 pharmacies in the network, so that means it's likely there's a pharmacy near you that's in network. Not guaranteed, but it's likely good. And another way it says it's likely that the pharmacy you love, it's not guaranteed, but it's likely it's in network for them. You can save on prescription if you go to in-network retailers. Some plans allow you to go out of network, but it's going to cost you more. And then you can actually save monies also by using mail order. That's also safe and convenient. So a couple different ways to save on these plans: go to in-network providers, and then go to use mail order, either one of those. The drug list in Medicare world is called the formulary. It's a list of drugs. Not every drug in the world is not exhaustive, but the ones that they cover are listed there. And every drug that's in there is tiered. It's called, they're labeled in tier 1 through tier 5. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs, and tier 5 is specialty drugs. And I suspect you might be able to guess the pricing and the associated copay goes up as the number of the tier goes up, but that's just the way it is. And they've got all their drugs that are on their list classified as one of those tiers. And that's usually we can calculate what the copay will be. What the copay is determined depending on what tier you're in. Having said that, step therapy is when you try to use a lower cost medication to treat a condition before going to the higher cost one. Quantity limits are when there's only a certain amount of a drug or a certain number of days that it's made available. And prior authorization, it's when the doctor, they need information from the doctor before they will agree to cover it. So those are kind of just some challenges or exceptions, if you will, to just straightforward tiers and the formulary. And having said that, if you need an exception, you can ask the plan to cover it even if it's not on the drug list. That's known as a formulary exception. You can also ask to have some of those restrictions waived, and that would be a utilization exception. If your doctor submits the exception request on your behalf, generally the plan will make that decision within 72 hours. It can be expedited or fast-tracked if your doctor believes your health requires it. So you can get exceptions to that formulary. Okay. All right. Now what I'm going to do, having talked about all that, I'm going to show you 4 plans side by side. And there may be, these exact 4 plans may not be available right where you are, but I suspect one or more of these plans is representative of a plan that is available near you. So my point is no need to get hung up on the very specific dollar amounts unless you live in the Dallas-Fort Worth area, but do look at the different functionalities, the different features of these plans, and see how they work. So here we go. Plan 1 and Plan 2, Advantage Plan and Choice Plan. These are original plans, I'll call them, because they've been around on the market several years. These are newer plans because they're only a couple of years in this market. Plan 1 is the most popular plan in the whole DFW Metroplex. The Advantage plan is a reformulation of that one. It's quite similar in certain ways, but there's certain give and take between the two. They're the most two similar plans of these four here. Plan 2 is the only one where you pay a premium. The other three are $0 premiums. And when you pay premium on Plan 2, what you do is you drive down your copays and you drive up your benefits. And then Choice Plan, it's a PPO. These other three are HMO, that is network plan carriers only. If you go to seek care out of network, then the plan won't cover you there. This one, you do have the option to go out of network, and there will still be, although it'll cost more, but you can go and get care out of network. So those four plans at a high level. We're going to look and see how they are alike and different. Monthly premium. Previous remarks, all of these are $0 premium per month except for Plan 2. Annual medical deductible is $0 on all four of these plans. Primary care visit is $0 on all four of these plans. Specialist visit, they're slightly different here. It's not a big difference, but the one with the lowest copay is the one where you're paying a monthly premium. That's only a $20 copay to see a specialist report. The choice, if you recall, that I said that costs more. That costs you $35 for a specialist visit on that one. The difference between these two, actually, that's the same price for this one. There's actually a slightly lower copay for specialists. So one of the differences between these two plans is a slightly lower copay for the newer plan. Specialist referral required? Yes, 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 no. Not only does this allow you to go out of network, it allows you to go and see a specialist without a referral. So this is called choice. It gives you choices, flexibility. It'll cost you more as you get care potentially, but it is a $0 plan. Okay, preventative service is $0 copay for all four of these plans. Nice. Here's one of the few big financially differences between these plans. If you go in inpatient hospital care, the plan where you pay a premium, it's a one-time fee of $150 copay. That's it to go to the hospital. For the other three where you're paying $0 a month premium, well, for this one, Plan 1, it's a $275 copay for days 1 through 5. After that, it's a $0 copay. So it costs you a little bit more to go to the hospital on that one. These next two plans, these newer plans, they actually cost you a little bit more per day on the copay, and there's an extra day. So it's $325 copay for these two newer plans, and it goes an extra day to do that. So maybe you get some more things in these newer plans, but then you're kind of giving some back there. But it's just important to know and understand that. Interestingly, for a skilled nursing facility, for days 1 through 20, if you have to go to skilled nursing, they're all $0 copay. After that, they have the same copay daily of $184, just the number of days that you have to pay that copay varies. On Plan 2, where you're paying the premium, you have the lowest number of days you have to do that. You only pay that for days 21 through 38. After that, it drops to $0 copay again. For Plan 1 and for the new version of Plan 1, if you will, the Advantage plan, you have to go to day 42 and pay that copay of $184 before it drops to $0. And then on the one where you have choice, you go all the way up to day 57. So if you had a skilled nursing stay, that plan is the most expensive one. I think you can see the trend going on here. Beyond that, outpatient surgery, there's a maximum copay on all these that reflect is the same numbers as the inpatient hospital care. It's $150 max on the paid Plan 2. It's up $275 for Plan 1, and these two newer plans is actually $325 as the max copay on outpatient surgery. For diabetes monitoring supplies and home health care, there's a $0 copay on all four of these plans. So I've got a few more pages like this on these plans, but I think you're already getting a feel for it. You pay it, you can pay an additional, many of them are available at $0. If you need the flexibility PPO, it'll cost you a little bit more one way or another. And if you're willing to pay a premium, you can drive down some of these copays, just kind of whatever you want. We can tailor a plan to you. So here's some more evidence of that. Diagnostic radiology services on the original plans, the max copay is $125, goes up to $150 on the newer plans. Diagnostic testing procedures, $20 on the original plans, gone up $25 on the newer plans. Lab services is $0 copay on all four of these plans. Outpatient x-rays is a $0 copay on all three of the HMO plans. For the flexible one, there's a $15 copay. Yet again, that thing where it costs you a little bit more for that flexibility. Ambulance is the same on all four of these plans, be it air or ground. It's a $250 copay on that. Emergency care is the same on all four of these plans. It's a $90 copay, and then that'll be waived if you're admitted into the hospital because you're in that different line item. That's the hospital stay. Urgent care is actually, it costs the same on all four of these plans, a copay, whether it's contracted or contracted, except for the one that's designed to have out-of-patient care. It's actually a $30 copay for if they're contracted urgent care with that plan. And now here's the biggest single number, the out-of-pocket maximum. Plan 2, where you're paying the premium, has the lowest out-of-pocket annual maximum of $3,200. Plan 1 in its new version the Advantage plan have a $3,900 out of pocket, and that flexibility of the PPO plan, the Choice plan, has $6,700 out of pocket max. So that's the biggest difference between those. So now you've seen basically the difference between those and how they work with Medicare. There's some additional bells and whistles that I want to make you aware of, and there's medication to consider. Without reading through this whole thing on medication, what I would offer is look at the tier 1 things across these. There's a $0 copay for tier 1 drugs in plan 2. It's $2 for plan 1, and it's $3 for the flexible. What a surprise. And the deductible here, it's a $0 copay for all these HMO plans. The deductible is, rather, I should say, for the Choice, it's a $0 deductible for only tier 1 and 2. For tiers 3, 4, and 5, there's actually a $345 deductible. So I offer you the same thing. It varies slightly, but you get more for your money overall on plan 2, and it costs you a little bit more for the flexibility of the PPO Choice plan. These are some nice bells and whistles that vary across here. So plan 2 has $1,000 of covered dental. Plan 1 only has $500. So that extra premium gets you that one. Oh, this new version of plan 2, remember, it costs you a little bit more for the hospital stay, for example, but you do get more dental. So that's one of the main differences between these two. And so my message is the two inside plans here are $1,000 of dental benefit, and the outside plans are $500 dental benefit. Routine vision care, all these plans have a $0 copay for a routine eye exam every 2 years. They have at least $100 allowance for eyewear every 2 years, except for the plan where you're paying more, they actually give you $200. So 3 of the plans are the same, but the one where you're paying, they actually give it $100 more towards eyewear. Original plans versus new plans, another difference here is there is some nice hearing coverage, a routine eye exam, hearing exam, $0 copay every 2 years, and then some low copays for equipment, hearing aids if you need it. And they've got a nice spectrum of that for these two original plans. That's not included in the newer plans. So another big difference between plan 1 and the Advantage plan, it's kind of dental, how much dental versus hearing you would consider. Insulin Senior Savings Program, it's $35 or less for a month's supply of insulin on all 4 of these plans. Gym membership at the bottom here, all of them have a membership with Renew Active, and as a part of that membership, that is kind of like the pharmacy. It's likely it will be a zero-cost gym membership to a gym near you. Not every single gym takes it, but many of them do because they've got a big network. And the one thing I skipped over here, I would mention, there's an over-the-counter benefit. Strangely, perhaps counterintuitively, you don't get it on the one where you're paying the monthly premium, but on the other 3, there is an over-the-counter benefit. It says $160 per year. It's really $40 a quarter. $40 a quarter, you can order online or via phone a series thing over the counter, things that you're not prescription drugs, but that you might get in a pharmacy. There's a catalog full of stuff, so it's aspirin, maybe allergy, maybe antidigestive. You can get Band-Aids, stuff like that. Personal care that you might get in a pharmacy over the counter. There's a catalog of stuff, and they give you $40 a quarter you can use. That's a pretty nice benefit. So having said that, I'm not going to read all this. These are the plan numbers and the counties they're offered. What I would tell you is if you live in the Dallas-Fort Worth area and surrounding areas, these exact plans are likely available near you. If you live in another part of Texas or in another state, there are probably some similar plans, different numeric values, but they work. There's a lot of functionality, a lot of similar benefits. I think those are available. So I think this is a nice side-by-side comparison to let you think about which ones appeal more to you. I do want to remark briefly about United Healthcare. They've got over 40 years serving the Medicare community. There may be other carriers, but I don't know if they've got 40 years experience doing this. More people choose United Healthcare for Medicare plans than any other provider. So they're number 1 in the U.S. market. Members like and keep their Advantage plan. They measure those things to check customer satisfaction, and people sign up for these plans and they really like them and they tend to stay with them. They tend to not switch. And then you have our promise and commitment to help you live a happier life, whether it's measuring this customer satisfaction, or I personally also man a booth at a local pharmacy answering Medicare questions on behalf of this carrier sometimes. So I can tell you they are committed to your health and your happiness. Okay, these are some additional resources that can be made available to you. Medicare Made Clear, electronic and/or hard copy. It's a nice packet. It's not unlike this presentation. It's got some high-level overview of Medicare and the options and stuff and plans it. So that's one thing we can make available. Medicare hotline, you can dial 1-800-MEDICARE and talk to somebody with the federal government to ask questions about that, how to enroll in Medicare Part A and B, that kind of thing. Medicare and You is a big, thick book that they make available. Typically, they send it to people via U.S. mail whenever you're approaching 65. You may already have that one, but it's a nice, big, thick, thorough reference guide to Medicare. Online plan finders, these are available online. You can find these plans and other plans and kind of compare them and look at them. And so that's available online. State resources, you can use a search engine to find that each state is different, but state to state, there's things like their state Medicaid office you can find out, check out eligibility, even enroll potentially for financial assistance. Social Security Administration, ssa.gov. You can talk to a human online or via phone sometimes. Basically, there, if someone takes Medicare and Social Security, you can actually get it set up so that $140 something premium can come right out of your Social Security benefits if you're signing up to take them both simultaneously. And then administration and or elder care locator, just a lot of tools that can be made available to help you find some of these things. Home health care is another example. So those are all available online. So having said that, I can help with these things. You give me a list of your doctors or hospitals or specialists, and I can look them up and confirm that they take these plans, for example. You can give me a list of your medications. I can show you what tier they're in, show you what the copay is, show you what the pricing is at different retailers near you. Assist additional resource. I can help you find a gym that takes the Renew Active membership. So it'd be a zero-cost gym membership near you. Find out if you're eligible for more benefits. I can help you check and see if you're Medicaid eligible, for example, at your state. And then if you're a veteran, I can help you find specific plans that are that could play nicely with TRICARE or your VA benefits. Maybe you're going to continue to get the medications from them, but you want to be able to get a gym membership and some dental. Well, I can help you find plans that will help you achieve all that. So having said that, I reiterate, this is me. My name is Tom Basie. It's nice to talk with you. There's my number there, 817-600-3248. And I'm probably even better reach via email. So I've got my email there, tom.basie@gmail.com. Just shoot me an email. Aparte, yo si hablo español, puedo atender a la gente en su idioma. So I'd love to help you. So I'm grateful for your time. I hope this has been beneficial to you, and have a good rest of your day.